We're going to talk a little bit about affective contagion. It's not just you. There's also negativity that exists, that can exist at home or in the workplace or among your friends or whatever. And the thing is, it's like secondhand smoke. It does affect you. And one of the ways I know this is that when I was a medical student, one of the things that we were shown was that the resident could interview a patient who had some kind of psychiatric disorder in front of about 20 people. So here's the resident, here's the patient, and the resident interviews the patient. There's people in the audience, you know, nurses and med students and so on and so forth. The patient gets up and leaves, and then the experienced professor comes in and makes the diagnosis. Oh, a depressed patient, or oh, a manic patient, or oh, a schizophrenic patient, without seeing the patient and without hearing a word. And the way he or she was able to do that was because they could just walk in and they could feel the affect. That's called affective contagion. You can feel the imprint that a depressed or a negative or an angry person leaves on a room. You can feel it if you sensitize, if you're open to it. Try it. You'll be able to feel it. Walk into a boardroom after the executives have finished whatever they're doing in there. God knows what they're doing in there, but whatever it is, try that. Okay, let's see an example here. I'd like to show a little film and see if you agree with me on this. Can we run that?
Dong.
1,000 connections per second that brain is making. And the reason that kid is so joyful is because its brain is getting exactly what it needs. And it's creating this feedback loop, and it creates this joy not in the guy too and in all of us. And that's one of the ways in which we're interconnected. And just like this can be true for joy, it can also be true for, I'm sorry to say, for negativity, so you want to avoid that.